Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Kathleen Muldoon, certified coach and professor. Today's Kevin MD article is Why Congenital CMV Should Be on Every Parent and Doctor's Radar. Kathleen, welcome back to the show.
I'm happy to be here. Thanks.
All right, so let's start by sharing the story that you wrote about in the article.
Well, I think the story starts with my own, and we've talked before about identity, and the evolution of kind of my personal and professional identity went from, scientist with earning my PhD in anthropology to teacher in medical education settings. Embryology had always been my area of specialties. Started growing my own family to mother, and eventually advocate when my middle child was born with a congenital cytomegalovirus infection. And I knew that cytomegalovirus was a virus. I knew it was the C in the torch screen, but it wasn't until the virus personally affected my family that I understood and began to research how common it is as the leading viral cause of disability in the States and worldwide. And not only that, but how little we talk about it, especially in medical education settings. And, my son is now almost 12. So over the last 11 years of becoming involved in advocacy and thinking hard and doing research about how do we talk about this virus. And, when I wrote the article, it was June, which is National CMV Awareness Month. And just reflecting on the fact that there have been, so many papers written, including my own research about levels of knowledge of CMV facts, right? And how often it's discussed, in the low levels of awareness generally in healthcare providers and in the population, right? And a colleague of mine, Gail Demler Harrison, who is a CMV expert, in 2016, she wrote a paper, 40 years is long enough, about talking about not only the CMV vaccine development, but just how we talk about CMV. And I think 20 years before that, there was a 20 years is long enough paper, and now we're coming up on 50 years. And, I guess what came out of me is really hopefully an invitation to think about how CMV has a messaging problem and the way that we talk about it. And I think this kind of has broader implications, right? As we think about the roles that clinical spaces play in preventative health and potentially rethinking what a single conversation can do for a patient's journey and becoming that care partner that also involves some advocacy. So that's where it came from.
So just to bring everyone up to the same page, so tell us a little bit about congenital CMV, the effects it could have, how we currently screen for it, just to make sure everyone here listening has the same background knowledge.
Sure. So the virus is a member of the herpes virus family. And so it lives in your body forever, once you get it. And CMV as a virus is usually not harmful to otherwise healthy patients. And when it becomes a problem is when you are immunocompromised. And so that happens in organ transplantation. It happens as a comorbidity of, for example, HIV. And pregnancy is a period of being immunocompromised. And so the danger of either contracting CMV for the first time around conception or during your pregnancy, or having a reactivation from the virus that you've already contracted, or contracting a new strain, that it can have effects on the developing brain of the baby. Mm-hmm. And so the way that we commonly see that is that it is the leading non-genetic cause of deafness, which can be present at birth or develop later with a later onset, because it can affect like the organs of hearing in the inner ear. So it's a sensorineural kind of hearing difference. And the more that we've studied it, and as states have begun to screen for it, we now know that it's also associated with other comorbidities such as, cerebral palsy and motor challenges, learning differences. There's new evidence that suggests it's correlated with the development of autism, balance issues. And so like every congenital condition, right, it's actually a spectrum of outcomes. And we tend to think of them as mild to severely impacted. And you mentioned screening, and only within the last 12 years, individual states have adopted legislation that either have programs that mandate CMV education of of pregnant people in prenatal healthcare visits and or screening. And screening can happen in one of two ways. It can be hearing targeted. So since CMV is the leading non-genetic cause of hearing differences, if a baby refers from is shown to have a hearing deficit on the newborn hearing screen, which is mandated in all states, then states that have a hearing targeted CMV screening program would then offer parents a CMV test to see if that hearing difference is due to CMV. But that misses, it only catch about 57% of the kids that are born infected with the virus, since hearing loss can show up later in life. And so several states, want to have a universal screening program, and whereas it's not been added to the universal screening panel yet, Minnesota and Connecticut and I think New York is investigating what would be the specimen they would like to use for a universal screen. They do have universal screening programs. And so Minnesota is kind of leading the way on that right now in testing all kids who are born for a CMV infection.
So currently, as you mentioned, there is no universal screening for congenital CMV. It's only in selected states. So if a screen produces a positive CMV test, what are some preventive measures then? So
if the positive test comes back after birth, then there's several treatments. So it depends on your definition of treatment. So the pharmacological treatment is antiviral treatment and that has been shown to improve the neurodevelopmental outcomes, including hearing, and even in some cases preserving, if not like delaying any differences in hearing thresholds. And another way to think about treatment is that diagnosis puts you at risk, right, for neurodevelopmental outcomes. And so early intervention and becoming involved in those programs and having a closely monitored healthcare team, which includes audiologic monitoring, developmental pediatrician, all of that will get set into place so that you can catch those early years of critical development and improve health outcomes for that child and for that family.
So I know that you're at the forefront of advocacy when it comes to congenital CMV. So tell us about some of the difficulties some face when confronted with this diagnosis. Tell us about some of the experiences you've had in terms of pulling that team together for your son. So tell us about some of the challenges you faced.
So I speak from my own perspective, and I'm representing like many parents in this situation. And my situation is unique because I am a CMV parent and I'm also a medical educator, and I also have access to not only, collecting primary data, but like understanding and reading the research. And so there are a few challenges that come up that I can outline that are easily within reach for all of us to kind of work towards. So the first is that healthcare providers, including primary care physicians, including OB/GYNs, including even otolaryngologists, have lower than desired baseline CMV health risk knowledge. So I phrase it that way because, in medical education, and I am one, right, I'm a professor, we often talk about, okay, if you have a child that's born with IUGR, then it's a soft marker for a suite of congenital infections. And so you're if this, then that, right? But it's very much if a brain looks like this, then that, right? And maybe going into a treatment plan, right? But that's not the same thing as understanding what is the risk for transmission and thinking about what clinical opportunities are there for you when you have a pregnant person in front of you to educate that person about the dangers of contracting CMV, which could be couched in terms of infection prevention more generally during pregnancy, right? So there is that kind of understanding that healthcare providers might know, like I did, that C is the C, the C in torch is CMV, or that CMV is a teratogen, but understanding like you can go a step further and talk about prevention behaviors and have that opportunity with anybody who's in front of you. It has been kind of a barrier. So people might think they know about CMV, but do you know about it in the right way? And are you equipped, right, to have the conversation that can actually improve public health outcomes? So that's one challenge that has come into play, and that, and I think we've discussed this before. We don't teach doctors how to say, I don't know that, and be humble to that. And we all can feel that like challenge of like, oh, I thought I should know that, and have this kind of like shame. But how do you deal with that? How do you use that as an invitation to pause and think, maybe I should learn a little more about that. And so that has been a significant challenge, not only in clinical interactions personally for my son, but also in educational spaces or like conference settings where we're just laying out, often I'll lay out all of the facts about CMV knowledge, CMV transmission, and be met with some pushback against the facts. And I think it's there. I'm going to use this word probably a few times. Like, there's no shame in not knowing if we didn't include it in your medical curriculum, right? And even in residency training, there has to be some understanding of the shift of like, what is your role as a clinical provider to be that public health partner, that a co-advocate with the patient around like improving healthcare outcomes. So that's on the clinical side. On the population public health side, 9% of women in the latest study that measured it know about CMV. And that's often measured as, again, here are a list of conditions, which of the following have you heard of? Which is just, can you pick it out of the list? And someone could ask me, do you know about neurophysics? And I would say, sure, I know what that is. I can't explain to you anything meaningful about it. That's just not in my training. It's never been on my radar. So again, we come back to, do you understand the health risk knowledge? Do you understand the behaviors that put you at risk for seroconverting during your pregnancy? And so I think it's a nuance in how do we talk about that? And then the messaging isn't just, do you know the facts about CMV, but do you know the facts that will help improve long-term health outcomes for the population of women and children?
You said that you received some pushback on some of the facts regarding congenital CMV. So what would be an example of a fact that you received pushback on?
So when faced with the fact that 1 in 200 children are born infected with CMV, those are the children that are born infected. So that translates to about 40,000 kids per year. Not all of those kids are going to experience apparent disease or disability, or it might be late onset, at which point it's too late to actually test. If a child presents with autism or hearing loss at like 6, 7, 8, whether or not that was related to a congenital infection. And so that is a fact that I think suggests that, if you empower families with that knowledge and offer screening, that it can improve outcomes, because people will be more aware of their behaviors during pregnancy, or even to get a test at birth, even in states that don't mandate universal testing. So the pushback is that knowledge will cause stress to the pregnant person, and stress can also negatively affect pregnancy. And in fact, several times I've been told it affects a pregnancy more often than CMV. So I would be happy to see some data on that, but we do have data on CMV and its negative effects on a pregnancy. So that's one area. And I think that verges on therapeutic privilege, right? Which I think the medical community has already decided that that's not ethical to withhold information, right? That can improve somebody's health decision making. So that's just one area, or even on, there's a conversation to be had about the economics of CMV screening, right? And how do we find an appropriate test? How do you integrate it with newborn screening that already exists? What's the appropriate specimen for testing? And, there have been several papers that have been put out about, what are the ethical, the financial, implications of these programs. And I will say that our community in the congenital CMV world is very collaborative between the infectious disease folks who have been working on this condition for decades, parents who, like me, find themselves thrown into the role of advocate, economists, people who work at the CDC or formerly worked at the CDC. And so we're really grateful that of a lot of the communities that I've seen, this is a community that is willing to sit at the table together and figure things out.
We're talking to Kathleen Muldoon. She's a professor of anthropology, and her KevinMD article is Why Congenital CMV Should Be on Every Parent and Doctor's Radar. Kathleen, as always, let's end with some take-home messages that you want to leave with the KevinMD audience.
So I really would love for, everyone to think about, especially this audience, what is your kind of role in the clinic as a care partner, right? Because you, especially in this case, will have parents coming to you with questions that you may not be able to answer, and understanding that, expertise comes in many forms, and how do you take that in, take that challenge, and partner with the person in front of you, because nothing changes behavior more quickly, I think, than stories over statistics, and you being open again and present to your role as a healer and not just a treater.
Kathleen, as always, thank you so much for sharing your story, time, and perspective, and thanks again for coming back on the show.
Thank you for having me.